It's a terrific honor and privilege to introduce to you Dr. Richard Barakat. Dr. Barakat is the director of the Northwell Cancer Institute. He's had a distinguished career in cancer. He's a major national and international leader, and we are so privileged to have his support and the support of his incredible staff, without which we would not be here today. Dr. Barakat.
Wow. I've been a cancer physician for over 30 years, and I have to tell you, this was one of the most incredibly moving and powerful things that I've ever witnessed, and I want to thank you for your courage and your bravery and for sharing your deeply personal stories with all of us. And I have to tell you personally, as the head of the Northwell Health Cancer Institute, you have strengthened our resolve and my resolve to make this an absolute priority for us. I know Dr. Weber will take a couple of moments shortly to comment on the testimonials you just heard and how it will frame the entire context of this meeting. So as Tom mentioned, my name is Richard Barakat. I'm a gynecologic cancer surgeon by training. I spent 29 years of my life at Memorial Sloan Kettering Cancer Center prior to moving to Northwell Health as the physician-in-chief and director of our Cancer Institute. So I wanted to take a moment to welcome all of you for being here today, the 5th Annual Early Age Onset Colorectal Cancer Summit. The Cancer Institute is a proud sponsor of this year's summit, and Northwell CME has worked diligently to make the meeting a success, as has many of our staff members and leadership, and special thanks to Kerry Wallace from Northwell Health for all of your help with this. So as you all know, those of you who have a major interest in this field, young adult colorectal cancer is rapidly emerging as a major cancer control problem, now affecting some 28,000 Americans under the age of 55 every year, and those numbers are growing. Remarkably, as of today, close to 20% of all colorectal cancers diagnosed in this country affect individuals under the age of 55. And I think we saw an incredible spectrum of patients sharing their stories today. Many are diagnosed late. What struck me as all of you bravely stood up is how many of you mentioned that you had stage 4 disease, and the challenges and delay in diagnosis for people not listening to you because of your age. And this has to change. This has to change. And I think the summit provides that opportunity to see and learn what steps can be taken now, today, to enact those changes, to reduce the incidence of adult colorectal cancer and its mortality. And I've had a personal friend with the experience, friend's son at the age of 24, who unfortunately succumbed to colorectal cancer. So the engagement of the Northwell Health Cancer Institute in this summit has opened many doors as to how we, as a healthcare institution and a leading cancer provider in the New York metropolitan area, can help lead the way in providing state-of-the-art young onset prevention, the earliest possible diagnosis, age-appropriate fertility-preserving treatments, as well as contributing to truly innovative research into the factors driving the increases in young adult colorectal cancer. And listening to your stories, it struck me that we're well on our way to doing that. For those of you who don't know Northwell, we are the largest private employer in New York, over 68,000 employees. We have 23 hospitals in the New York metropolitan area, including our announcement of a launch of the largest medical construction project in the history of New York with a brand new hospital at Lenox Hill. But what makes us really important in this fight is the number of primary care physicians and specialists that we have that we can harness those forces to work on screening and prevention, because while it's important to treat early adult onset colorectal cancer, it is, in my opinion, more important to prevent it and to diagnose it early. And that's where our efforts, I think, will really start to take shape. We also have a Center for Cancer, Pregnancy, and Reproduction, and have a major effort in in fertility preservation, and I think you heard many stories today from our brave survivors about how they needed to be given the information for what their options were for egg harvesting, embryo freezing, et cetera, sperm banking, all of the things that are so crucial. So we are excited to see participation from leading academic medical centers from across the United States as well as Europe. The Northwell Health Cancer Institute and myself personally wish you every success in making progress against this growing challenge in young adults. And as you will see, there are a multitude of practical steps we can take working together to increase awareness of the problem and readily reduce young onset colorectal cancer incidence and mortality. So I'm excited to hear about all of the amazing changes that are going on. We heard a lot about the genetic changes, and I'm thrilled that one of the speakers today, Dr. Noah Kauf, is going to be joining us from Duke as the new head of cancer genetics at the Northwell Health Cancer Institute, since genetics does play such an important part of this. So thank you all again for taking the time to be with us today. Thank you to the incredible survivors here for your bravery and for sharing your deeply personal stories. I don't think there's no way you could have not been deeply moved by what we heard today. It was really amazing. And I said, as I've said, we'll strengthen all of our resolve to tackle this problem. So Dr. Weber has put together a very aggressive timeline. There's a lot of talks. I was looking at the program, and I hope you guys are fast talkers because you got a lot to get through. So roll up your sleeves. Let's get to work and make this an unbelievable summit. Thank you so very much for being here.